Hi everyone. So today we're diving into a super important topic that doesn't really get talked about enough, and that's preeclampsia. It affects about 1 in 20 pregnancies worldwide, and while it can be serious and even life-threatening, the good news is that with early detection and proper care, you can really improve outcomes. If you're pregnant or supporting someone who is, this video is for you. Let's get into what preeclampsia is, how to spot it, and what you can do to stay safe. So preeclampsia is a serious blood pressure disorder that can develop during pregnancy or even shortly after delivery. It usually shows up after 20 weeks of pregnancy and most commonly in the third trimester. If left untreated, it can pose major health risks to both mom and baby. So how common is it? It affects between 2 to 8% of pregnancies worldwide, so that's about 1 in 20 pregnancies. Not super common, but also not rare either. It's responsible for over 50,000 maternal deaths and around 500,000 fetal or newborn deaths every year worldwide. So that's really significant and also why I want more people to know about this. So let's do a quick refresher on what blood pressure means. So the top number is the systolic blood pressure, and that's the pressure when the heart contracts. The bottom number is the diastolic pressure, and that's when the heart relaxes. A normal blood pressure is typically under 120 over 80 millimeters mercury. So how is preeclampsia diagnosed? After 20 weeks of pregnancy, you can be diagnosed if you have high blood pressure that can be either 140 over 90 or higher, and either high levels of protein in your urine, also called proteinuria, or signs of organ dysfunction, such as abnormal kidney or liver function tests. If you have high blood pressure without the other signs or symptoms, that's just called gestational hypertension. And your OB will likely confirm your blood pressure with repeated readings and some other tests like urine or blood tests to check your organ function, especially things like your platelets, your kidneys, and your liver function. So what symptoms should you watch for? This is the tricky part because preeclampsia can sometimes be silent, which means there's no symptoms at all. And that's why regular prenatal checkups are so important. But when symptoms do appear, these are some of the ones that you should look out for and that tend to be a bit more common. So headaches that don't go away even after you take some medication for it, vision changes like blurry vision, seeing spots or flashing lights, sudden swelling in your hands or your face, nausea and vomiting, especially if it starts in the second half of your pregnancy, so after 20 weeks, rapid weight gain, especially if it's more than 5 pounds in 1 week, so that's a pretty significant jump, trouble breathing, or pain in your upper belly or your shoulders. So if you have any of these, especially after 20 weeks of pregnancy, you should contact your OBGYN as soon as you can. In more severe cases, symptoms can include things like very high blood pressure, so over 160 over 110, low platelets, abnormal kidney or liver tests, and fluid in your lungs. So those would be reasons to also seek medical attention as soon as you can. So what causes preeclampsia? The exact cause isn't fully understood, but the leading theory as of now is that in preeclampsia, the blood vessels of the placenta don't develop properly, and that leads to poor blood flow and oxygen flow to the placenta. And that somehow seems to trigger blood pressure issues in the mother's body. So who's the most at risk? So there are a few high-risk groups for developing preeclampsia. So these are any mothers who have had preeclampsia in a past pregnancy, mothers who are pregnant with multiples, so twins or triplets, for example, anyone with chronic or long-standing high blood pressure or kidney disease, diabetes, and also autoimmune disorders like lupus. People in the moderate risk category would be anyone with a first-time pregnancy or being pregnant after more than 10 years from your last pregnancy, obesity, so your body mass index over 30, being over the age of 35 when you're pregnant, in vitro fertilization or IVF pregnancies, a family history of preeclampsia in your mother or sister, for example, and Black and Hispanic women due to healthcare inequities that tend to occur in those populations. So what are the complications that you should know about? Preeclampsia isn't just something to brush off because it can lead to really serious complications, some of them life-threatening. So for example, eclampsia can occur. So that's when seizures occur during pregnancy due to preeclampsia. Something called HELLP syndrome, or HELLP, is a life-threatening condition that involves red blood cells breaking down, major liver dysfunction, and low platelets. And that has a really high death rate associated with it. Also, organ damage can occur to your kidneys, liver, heart, brain, for example. You can have bleeding issues, placental abruption, which is when the placenta detaches from the uterus, which is very serious, fetal growth issues or premature birth, which also has its complications, and unfortunately, stillbirth, maternal or newborn deaths. These are also a possibility. So how is preeclampsia treated? Now, treatment depends really on two major things. So how far along you are in your pregnancy and how severe your preeclampsia is. So that'll dictate what the doctor recommends for you, but generally it may include hospital monitoring, medications to lower your blood pressure and prevent seizures, and possibly early delivery of the baby if the baby or the mom is at risk. So that'll really depend on your specific situation. Postpartum preeclampsia often resolves within a couple of days, so 48 hours, but still can require close monitoring. Is there anything we can do to prevent preeclampsia? So there's no guaranteed way to prevent it, unfortunately, but there are some ways that you can lower your risk. So first of all, the key thing here is to attend all your prenatal visits so that you can get all your routine blood pressure checks, urine tests, blood tests, or any other tests recommended by your OBGYN. Next is to watch for any signs or symptoms such as those that we listed before, especially things like headaches or vision changes that don't go away and start during your pregnancy. You also want to maintain a healthy weight during your pregnancy and follow any recommendations from your doctor as to physical activity levels, things like that. And finally, managing any pre-existing conditions such as high blood pressure or diabetes is going to be really, really important. And your doctor may also recommend additional strategies depending on your specific risk factors, so that'll be on a case-by-case basis. So preeclampsia can be very serious and has a lot of major complications, but being informed, knowing the signs and symptoms to look out for, and keeping up with your prenatal care and follow-up visits can make all the difference. Early detection is key. If you found this video helpful, please give it a thumbs up, subscribe, and share it with other parents or parents-to-be. Thanks for watching, and I'll see you in the next video.